Well, aloha and good morning. It is Monday, June 15th. We begin the start of another week here together on the COVID-19 care conversation. I'm Ryan Kalesuji, joined by Yanji Denise, and we are here, of course, to bring you some information as well as resources to inform you about some of the things happening regarding COVID-19 here in the state of Hawaii. We have not one, but two guests joining us today here on the conversation. We're going to start off, of course, with Governor David Ige to talk a little bit more about some of the new numbers that have been coming out and the state's efforts to reopen. And Yanchi, we also have another special guest joining us a little bit later.
Yeah, we have Dr. Thomas Lee. He's an assistant professor of epidemiology at UH. He is also works for HAIMA in his role as serving as a member of our military. So he comes with a very unique perspective, serving, obviously in that role at HAIMA, and then also in his role as an academic, how those two things come together. He's going to be talking to us about some of the risks with opening the state and tell us a little bit about what is going into that thought process and some of the modeling that has been done for Hawaii. It's really interesting science. He's going to break it down in terms we all can understand. So we're excited about that. There's a lot to talk about. We see the questions already coming in. We really appreciate the governor's time. Of course, Governor, let's just dive right into it. And we see these questions pouring in. We had, we always like to start with the case count. Yesterday was a better day than the two previous days, 5 new cases. But Friday and Saturday, we saw double digits for the first time since, I believe, April 18th. And those were not very encouraging. What's your take on what's happening with the new cases?
Well, a couple of things, Yanji. I just want to kind of remind everybody that we're in a much better place today than we were even 4 weeks ago or 2 months ago. And so we have increased testing capacity. We've more than increased by more than 20 times testing capacity in March, for example, and now can complete more than 5,000 tests per day here in the islands, and we can get results in 24 hours. And that makes a tremendous difference. So we did anticipate, as we relax the restrictions, that we would see an increase in cases. So, it's certainly a concern, and we're monitoring what the trend is. And so definitely the trend is to higher cases. But we feel pretty confident that we have the testing, the contact tracing in place that would help us to respond to an outbreak and really contain it as quickly as possible.
Governor, we're seeing throughout the country just the number of cases beginning to rise. Some states reporting record high cases right now after sort of this reopening efforts. We looked at some of the other states. Governor of Oregon actually pushed back their plan by at least a week after the governor there said that the number of cases exceeded sort of their established threshold of new cases. Is there some sort of threshold that the state of Hawaii has sort of set in place that if you see a certain number of days with, let's say, 25 or more cases or whatever that may be, what is Hawaii's threshold for maybe saying, okay, we might have to scale back on some of these reopening efforts that some of these states are now doing?
Certainly, Ryan, we're trying to come up with specific metrics, but it would be changing all the time depending on where we're at. The real focus is the trend that we're observing, and whether the cases are, a result of uncontrolled spread throughout our community, or if it is somewhat explainable in clusters of people who have been infected. And what you see, even with the spike in the numbers, they are limited to specific clusters in different regions. And, just to give you an example, we are in a much better place today than we were 4 weeks ago. We had that cluster and that family out in Waipahu, and we were immediately able to organize contact tracers, and we canvassed the neighborhood, was able to test 300 residents and neighbors in that area, and all of it came back negative. So it's that capability to test, to do contact tracing that allows us to be able to respond to higher numbers and still feel confident that we're protecting the health and well-being of our community.
I'm looking through these questions now. Caprice, Viveros, and Lake Maddow, and there's another one here that, let's see, where was it? Sorry, Lisa Paginton, all basically asking the question, Lisa's question, please just give us a date when mainland travel will open and if COVID test is required. I think that's, everybody wants to know, when will there be travel allowed from the mainland without that quarantine?
Well, certainly, Yanji, we are going to allow it when we feel that it's safe for our community. We're working on a couple things. So, the general quarantine will probably be the last thing lifted because we still see virus outbreaks. As you said, they've had record highs in Oregon, California, Arizona, Nevada, all those states that bring a lot of visitors to our island. So, we're monitoring that, and really it's about whether the infection rate in their communities would pose a risk to here in the islands. And so certainly what we are looking at doing is ways to accelerate bringing visitors here in a safe way. So the whole notion of testing before they get on a plane within 72 hours, if we can get a validated certificate that talks about them taking a COVID test and being negative, would allow us to create other systems of screening so that they can come here and wouldn't put our community at risk.
I want to talk a little bit more about that pre-testing that, is being floated out there. Some saying as long as the test is taken 72 hours before getting on a plane to come to Hawaii. From a legal perspective, can the state require all visitors to take that test? Is that, something that the state can do? And the other question is, are tests readily available for people to say, I'm going to Hawaii, I need a test? Will these states be able to give these people that want to come to Hawaii a test? Is that something that you think is readily available for that option?
Well, so certainly, Ryan, we are working with the vendors who administer tests and really making sure that they would be willing to give a test for anyone traveling here. We're talking with some of the drugstores and the pharmacies who have national networks. And I'm working with them about whether they would be willing to administer tests without a doctor's order or prescription for the testing. So we want to make sure that if we allow pre-testing prior to arrival in Hawaii to avoid the quarantine, that they would be able to get it readily in those communities that are most important to us.
Hekoa Ao has a question. Other countries have testing clinics set up at airports. With money from the federal government, can we set up testing clinics at the airport and in Waikiki? My understanding is that it would be better to have them at the point of departure as opposed to the point of entry, because if they are infected, you don't necessarily want them getting on a plane. And then once they're here, what happens to them? Where do they go? But what about that idea maybe of having both in place, that they get tested there and that there is also a mechanism to test them once they're here if they haven't gotten that kind of clearance?
Yanji, the challenge, I think, is our entire testing capacity here in the state of Hawaii is about 5,000 tests a day. And remember, we were receiving 30,000 visitors a day. So clearly, if we get any kind of numbers of visitors returning, we would far exceed our testing capacity. And really, I don't want to put at risk our community, somebody who's symptomatic and needs to get tested, and not have the ability to test here locally. That really is not an acceptable solution. So we want to encourage testing prior to getting on a plane. As you said, we don't want them to arrive here, get tested, find out that they're positive, and then we have to put them up in quarantine. And then the question is, are we responsible then to pay for that quarantine or not?
The other topic another viewer asked is, what is the progress on some of these travel bubbles? We've also heard it referred to as travel corridors. In the past, I know that you talked about it briefly last weekend in a press conference. But what is the realistic timeline for these travel corridors to be opened again? Because in talking with the airlines, they said they're going to need time, obviously, to begin scheduling and being able to open all that up. What is the status on these travel corridors, and how long do you think that would take to get up and running?
So Ryan, a lot of the travel corridors deals with international relations, and I've reached out to all the governments, Japan, Korea, New Zealand, and Australia, to at least begin the dialogue. One of the challenges for us here in the islands is we're part of the U.S., and they see the continuing high virus counts in the United States. And so for many countries, they just shut down travel from the United States. So we're working to say Hawaii's different. Please have different rules for people who are residents in the islands. So that gets to be a little bit complicated. We continue to dialogue. Ryan, all of these efforts are really to accelerate bringing visitors here ahead of being able to lift the mandatory quarantine. And so, we're working very hard to get it done as soon as possible, hopefully in July, August kind of timeframe is the general parameters that we're looking at. Yes, the airlines are in a better position to restore travel. Most of them continue to have at least some minimal flights that are coming to our islands. So getting those back on schedule, if you actually try to book a flight to like Korea or Japan 2 months from now, there's a schedule that allows you to do that. But the airlines are shutting it down as we extend the quarantine. So the airlines would be faster. They can probably respond in 2 weeks kind of time frame. The hotels are the ones that need 4 to 6 weeks to be able to reopen ahead of us bringing visitors in.
So the goal then, from what I'm hearing you say, the goal is sometime in August.
Yeah, certainly, Yanji, the goal is ASAP, but realistic, it would be August.
Okay. Megan Poole has an interesting question. What about someone traveling with a child under 18? CVS doesn't test minors. If we did have that pre-testing system in place, would you require everyone in a family to get tested? Would it just be one representative of the family? How would that work?
Certainly we're working through those details at this point in time, and we do acknowledge that some of the pharmacies and others that are doing the testing don't test children, for example. So all of those would be going into the policies as we move forward with this whole pre-testing program.
I want to kind of shift gears just a little to more of just a local standpoint. And, we're looking at the unemployment numbers that continue to go up. One of the concerns is that the PPP loan sort of expires for many businesses that, this month and in these next few weeks. And some are expecting to have to make some decisions on what they're able to do now that they don't have that support from the federal government and that funding. We also know that it's also impacting the unemployment office. And we're getting reports from people who said that they've been waiting since March to receive some sort of payment or even just a communication back. What can be done maybe to help these people who have been waiting for 2-3 months for some sort of contact and information, as these numbers might grow as some of these PPP loans and money run out?
Certainly, Ryan, we've been focused on getting to all of the people who have made an application with unemployment insurance. The last numbers, I just got a report at the end of last week that remember 220,000 or so had actually filed applications. We're down to where it's 17,000 that we continue to have trouble making contact, or their case is complicated. A part of that 17,000 includes several thousand of people who have completed the application, but when we process the payment, the bank accounts provided were incorrect. And so, obviously we're reviewing that because of all of the fraud that has occurred, all across the country. But, we have at this point processed 92% of the applications, and we are driving for that last 17,000 individuals to make contact, to find out exactly what the issue is and resolve it as quickly as we can.
I know you're addressing the issue of individuals. Let's talk a little bit about small businesses. I feel like every day, on Instagram or social media, I see another restaurant or another small business that says something like, unfortunately, because of this, we can't continue, we're closing our doors. And it's just heartbreaking to see that. As Ryan mentioned, PPP money is about to run out if it hasn't already, depending on when those companies receive those loans. What can be done on the state level to try to help some of these small business survive through this time?
Yanji, I think that is, part of the challenge for our community. And really, it has been difficult for me personally, seeing these small businesses. so committed to supporting their employees, and yet, the financial reality that we're starting to see. I just would encourage those who got PPP loans to really relook, as we know additional funds were provided to the program, and they've relaxed what you can spend the money on and what that time frame for spending might be. So certainly for those, I would encourage them to relook at that program. Remember, the federal government has provided support to more than 21,000 businesses, and it's resulted in $2.6 billion of support for the businesses. The state just does not have that kind of money to provide the support. We're facing a budget shortfall of $2.25 billion in the next 12 months. And so clearly, I wish we could provide more support, but we just don't have the resources to be able to support businesses in the same way that the federal government can.
One of the other questions, of course, is surrounding just the schools opening up again. But along with schools, it's the University of Hawaii that's opening up as well. Is that do you see things sort of being lifted to allow some of the students to come back to school in time? We know that there's, of course, a lot of out-of-state students who will be traveling back here to go to classes at the University of Hawaii at Manoa. What would that process look like for these college students that are trying to get back to school and go to classes?
So certainly, Ryan, we're working with the University of Hawaii, and the plan would be that there would be some quarantine of incoming travelers, especially if they're coming from California, Oregon, even Washington State. The West Coast still continues to have a high COVID-19 count. So I know that I spoke with Dr. Lasner, and they're looking at what would be required to reopen the campus. As you know, a month ago or so, they did announce that they are going to reopen, and it will be a combination of in-person classes as well as online learning. We continue to look at what the guidelines are. As you know, we reissued the child care guidelines and recognize the challenges of providing child care, especially with the smaller group sizes. So we did reauthorize childcare providers to maintain the ratios that they had before COVID-19 swept through our community. I can anticipate we're working with public and private schools to issue guidelines for public schools. We know that a public school can't operate with physical distancing of 6 feet and limiting bus transportation, for example, and even inside the classroom. So it is about recognizing that these institutions are fundamentally important to our community, and they have to reopen. And how can we manage the risk, reduce it to the extent possible? But I think most importantly, everyone needs to recognize that they need to help take personal responsibility. Parents need to know that if their child's sick, they can't send them off to school. Those kinds of actions that each and every one of us need to take to make schools and childcare and universities really work and be safe communities for the students, employees, as well as the broader community in general.
I know that this is in the purview of Dr. Kishimoto, but I'm sure that you have a say in this as well. I'm wondering, when she was on before, she talked about doing a combination of distance learning and in-person classes. Is that what you're envisioning for fall?
Yes, certainly. And Yanji, the biggest challenge, I think, and what Dr. Kishimoto is struggling with is the fact that, there are many students that can thrive in an online learning kind of environment, but the children and the students that need the most help usually are the ones that have the most difficult time learning in an online environment. And so we are being focused. We know that reducing the number of children on a school campus is part of what the new normal will look like. But we want to be certain that especially those students that need the most help can be on campus and continue to receive education and learning in the traditional process of a teacher in a classroom.
Finally, this is, I know that you have to head out here soon. So just sort of wrapping up, big week, of course, with the inter-island quarantine being lifted this week. Are you confident that the state is sort of ready for this next phase? I know that, there's a lot of new measures, including travel forms for inter-island travel. What is your thoughts going into this kind of next phase of the reopening of the state?
Certainly, Ryan, I feel confident. It is a new process, so encourage everyone, if you're traveling inter-island starting tomorrow, to arrive earlier than you normally would. The form is available online, so I encourage those traveling to download it, fill it in, make sure that they respond to all the questions, and print out the forms and go to the airport having completed them, because that will really help us do a better job. And I just really ask everyone for their patience. This is a new process. We are putting more employees at the airports to help facilitate that. But until everybody gets used to it, it will take a bit longer to travel inter-island.
All right, Governor Ige, thank you so much once again for spending your Monday morning with us and giving us sort of an update. We look forward to more announcements through the week, and we'll see you back here next week.
Yes, thank you so much. I really appreciate it.
All right, take care.
Thank you.
Aloha.
Okay, so he says ASAP is the goal, but realistically, we are looking at sometime in August for doing some kind of an opening of trans-Pacific travel, whether that's the mainland, whether it is, some of these travel corridors or travel bubbles, if you will. Very interesting. Tomorrow, Paul Unamine from Central Pacific Bank is going to be on here. He's been part of the group that's been working on these trans-Pacific bubbles, looking specifically at countries like Japan and South Korea, New Zealand, Australia. So he's going to be doing a deep dive on what that actually could look like. So I know a lot of you had questions about that, and why are we looking at foreign countries? Why are we not looking at the mainland US? We're going to be diving deep with him on that. So please join us tomorrow at 10:30. Right now, we have another guest. We always like to bring another guest in on Monday. We're so lucky because Hawaii Data Collaborative is partnering with us every Monday. They're going to be helping supply a guest to us, someone who can give us some real science, Ryan.
Yeah, that's right. We're excited right now to bring in our next special guest, who will be speaking a little bit more about that. Dr. Thomas Lee, a U.S. Army medical officer from the 1984th U.S. Army Hospital Pacific 9th Mission Support Command. Sorry, it's a long title. He's also the assistant professor of epidemiology at the University of Hawaii at Manoa. But Dr. Lee currently serves as a lead modeler and forecaster for Hawaii's Emergency Management Agency, or HIEMA, in terms of this COVID-19 emergency response. Dr. Lee, thank you so much for taking time to join us here this morning. We just heard from the governor about some of these efforts to talk about the reopening of Hawaii and this new model of testing. And these are things that you guys are specifically looking at. What are you seeing in terms of the cases and numbers and the things that you're researching about opening up the state, and your thoughts overall about how that could all unfold for Hawaii?
Good morning, Ige and Ryan. Thank you for having me. It was really a great opportunity to listen to the governor just now. So in terms of opening up and what we're expecting to see, really what my role is to support policymakers such as the governor to make these very important decisions in terms of opening up travel, because we know our economy and everybody in our community is looking forward to that. And there's a lot of epidemiology that goes into this what might seem like a very simple thing, choosing a date to open up. But like the governor said, it's really much more nuanced and complex. Especially as we apply our best practices and best information that we know from epidemiology to these very important decisions. So really, he mentioned the 14-day quarantine period. That's probably the last thing to be lifted. I agree, because really that's the most important thing, protecting our community from increased COVID cases, but we understand the impact that has on our economy. So working with guidance from the governor and the policymakers, Dr. Hara, to create different scenarios in terms of our modeling and forecasting, to give them guidelines on what we might expect to see if we did this or that in terms of policies. That's really what we try to do within HIEMA.
Well, let's talk about that 3-day, because that seems to be sort of the thing that everyone is globbing onto now. This idea that we get tests, that someone coming from the mainland or a returning resident gets tested within a 72-hour period. How effective would that be at actually reducing the spread of COVID here in the islands and keeping it out of our state to begin with?
That is a great question. Testing, so I want to be sure that everybody's on the same page. This refers to the PCR testing, the nasal swab. That really is a point prevalence that tells, the results tell you whether or not at the time of the testing you have COVID or not. And researchers within the state have done great jobs in terms of writing white papers to see what the potential impact would be. My opinion is that it would definitely have a positive impact on potentially reducing the number of cases imported into the island, not just from tourists, but also from returning travelers. You have to remember that it's really not just tourists. It's our ohana that travel to the mainland, come back, that also could potentially be a case coming into our community. In terms of, so I apologize. What was the
Well,
second
so
part of the question again?
how effective would that be at actually limiting? Like, do we have a percentage? Like, if we do it, will we keep
Correct.
half of the cases out? Because we do know that just because you test negative, 72 hours doesn't mean you can't get infected on the plane. I think there's a graphic that we wanted to show that kind of will help to illustrate this, Ryan.
Definitely. So this graphic really, if you look, so these 3 red dots are potential places throughout a person's journey to Hawaii where they could, even if they test negative on the PCR test 72 hours or even 24 hours prior to travel, they could interact with other travelers either at the airport, on the airplane, or upon arrival and become infected with COVID. What we're seeing from other parts of the world and even within our country, and specifically I wanted to bring up this really good case study with the United States Army. We had 642 recruits at Fort Benning who followed all the protocols. They were tested prior to entry into the base. All but 4 were tested negative. So the 4 were isolated. The other remaining 636 were quarantined for 14 days, right? Best practices. Then following mask wearing, physical distancing, they started their training. 8 days after that 14-day quarantine period, someone developed symptoms. They retested. 22%, or about 124 of them who were tested negative prior to both the 14-day quarantine period and that additional 8 days were then tested positive. So really what that tells us is that even if we have the best testing practices, there is still a possibility, and the public really should be aware that there's no way we can mitigate the risk down to 0. But everybody has the ability to do their part, wear a mask, physical distance, to do their best to mitigate the risk. And really the reason why the Army was so successful in reducing the impact of this cluster was their quick contact tracing. And I know our colleagues at Department of Health and Disease Outbreak Control Division work around the clock to really quickly identify new cases, identify the contacts, and conduct testing of everybody who was in contact, at least close contacts, to make sure that there are no asymptomatic or pre-symptomatic cases who potentially could go out and spread into our community.
Those are some staggering numbers, and that example that you shared there, because when you think about it, we're hearing a lot of people, I think it eases some of the worries that, okay, we're getting tested and we're coming in here, we should be okay. But there is still that threat that it can still find ways to, impact the community to a large number. What else are you seeing, other examples or other countries maybe where what the numbers are looking like there as other countries have slowly begun reopening? We've heard some reports of some countries in Asia that have also seen spikes. Like, how closely are you monitoring what's happening not only in the United States but in some of these other countries?
So Ryan, my first and foremost job is to focus on the state. However, as epidemiologists, we know that the disease is everywhere, and we want to learn as much as possible from the trends in different populations, because that does inform our decisions for the state of Hawaii. So, China, as recently as this past weekend, had a cluster of cases. They had gone, I believe, 2 months without really any significant case count. But in a market, they saw a potentially big cluster there. But the thing to point out is the reason why they were so successful in that was they quickly contact traced and prevented the spread. They contained it. They didn't have to resort to mitigation efforts such as forcing everybody to stay at home which is useful. But once again, we see the economic consequences. So really, the stress is we can test, and we should test if we can, if we have the PPE and the ability to. I know the governor said we have about 5,000 a day, and we want to really reserve that for our kama'aina, for those who work and live in our communities. And so I support some sort of pre-flight screening, as long as there's some benefit to it. But really what we should be supporting is our colleagues at DOH in terms of their contact tracing efforts to make sure they have everything they need so that we can quickly identify cases and really prevent any community spread.
We always like to invite the audience. Marge Bamford has a question that relates to what you just said. What about another test after they arrive? And as the governor said, we had about 30,000 arrivals pre-COVID every day. We only have 5,000 tests. So that doesn't seem like it would be very realistic. Is there some kind of way to continue to monitor these folks after they come? If it's not a test, is to track them, if you will, or, once they've gotten that 3-day clearance, are they kind of just like free to roam?
So Marge, that's a great question. So, and then this ties into the contact tracing, but also the education piece. If we do a great job educating all of our returning travelers and our tourists, say, hey, we want to keep Hawaii safe for our residents and for our tourists, it's everybody's responsibility, like the governor said, to, if you do feel symptomatic at all, that's okay. You contact your PCP or whoever your provider is on the island, making sure you don't go to the ER first. We want to keep our healthcare facilities as COVID-free as possible. And then the policies and procedures in place by the Department of Health will take into effect, and then they will get the contact information, make sure that all the testing procedures are followed so that we can really contain any potential spread. So although we have policies in place, it still comes down to every individual understanding we have a responsibility to do our part, not just by wearing a mask and physically distancing ourselves. But if we are symptomatic, that's okay. We stay at home if we're sick, and we contact our primary care provider to get further guidance.
Sorry, go ahead, Ryan.
We sort of call this segment by the numbers. And so I want to ask you about those numbers. We heard the governor talking about some of his explanations about some of the larger case counts, but we saw these pretty alarming numbers. We were so used to seeing these 1s and 2s for a number of weeks. And then, we come out to these large numbers that we saw over the weekend of these positive cases. What is your overall thought in someone who tracks the numbers specifically and looks at all these things? What are your thoughts on some of these rises in these case totals?
Great question. So I would say every epidemiologist would have predicted that as you increase movement, we're going to see more cases. An analogy I like to give is, let's just say we have 50 cases on a day. What concerns me is not, less about the number, but about any potential clusters, right? So if you have one cluster of 50, but we contain it quickly, DOH does a great job, Department of Health and Disease Outbreak Control Division does a great job identifying them quickly, contact tracing, I'm not worried. But if we have 5 different clusters of 10, right, that means that something is going on. Maybe we're not getting our education efforts fast enough, we're not doing our surveillance quite well enough, that there's 5 different clusters. That's more concerning to me, even though the absolute number of 50 remains the same. In terms of moving forward, really it's going to depend on the policies that are coming, that the governor and all the policymakers will have. And once again, there's so many, I want everybody to understand, the modeling is not meant to really predict the future. What we're trying to do is we do have numbers in terms of expected cases, hospitalizations, but it's so dependent on potential assumptions. And the goal for us within HAIMA, Hawaii Emergency Management Agency, is to take things that are specific to Hawaii, right? Like our geography, like our age distribution, our ethnic distribution, to make sure that whatever we give our policymakers is as accurate for Hawaii as possible.
Runika has a question, and it goes into something that we wanted to address. I know that our time is running out, but she says, why the mask if 6 feet apart work? Why the 6 feet if the mask work? Why the lockdown or quarantine if both work? So we wanted to have you, in layman's terms, explain what this R naught number is, the basic reproduction number. Why is that important to infection? And guys who are watching, trust me, this is important. We want to learn about this. So, and it ties into Runika's question in terms of that R naught number and what these I don't know, mediation measures are. So please tell us a little bit about that.
Sure. So this R naught, and really, I know any technical term can be very intimidating. So let me just break it down in terms of what that refers to is how infectious a disease is, right? And so what we know about COVID is, to our best of our knowledge, if I'm infected and I'm in a bubble, and there's 5 other people, I'm likely to infect 2 to 3 other people without anything else going on. Obviously, we don't live in a bubble. We live in, let's just say Hawaii, for example. We are in a place where there's high humidity, which can decrease the possibility for aerosolized transmission or really tiny droplets. But basically, there are a whole host of things that can change this number of 2 to 3 to either increase it or decrease it. So in New York, you have highly densely populated areas, which will automatically increase the transmission likelihood of COVID to more than 2 people per person, right? And that speaks to the infectiousness of COVID. If you wore a mask, right? So we know about that 6 feet. That's, if you speak loudly, if you sing, if you project really well, it's possible that within that 6 feet, you're gonna spit or you're gonna have some sort of droplet come from your body and land on someone, and they could potentially touch the face and then touch their eye or touch their nose, and that's how you get that droplet or airborne transmission. By wearing a mask on top of the 6 feet, our goal is to continually reduce that number from 2 to 3 to below 1. Once we get that number for that R naught below 1, that's where we really see a decrease in our case count, or if you heard the term blunting the curve, right? Once we get it below 1, you're slowly going to decrease the number of new cases that's transmitted per person. And over time, that's going to result in a really low case count, which is what we see in Hawaii.
That's why we need the mask and the 6 feet then.
Correct.
One of the things as we sort of wrap up here, we know that the Hawaii Data Collaborative is sort of bringing together some of these different policy makers, as well as people who specialize in this area of formulating these numbers and really observing this. What more can you tell us, or how can people maybe learn more information about some of the things that you guys are working on every single day? We know that there's a website as well, but what are some of the things that people can do to learn more about some of the more specific things that you guys are uncovering?
So great question, Ryan. So Hawaii Data Collaborative is a great place to start. They do what they do is they take the information that's available and they put it in a way that's easily digestible, not just in a written format, but in a visual format. A lot of us, even myself, when I'm looking at something new, it's just an Excel sheet. It takes me a while to dig into it, but when I see a graph, it's much easier to pick it up. So I would recommend the public turn to Hawaii Data Collaborative first. They have a great team there. The goal for HAIMA is to continue to take the information that we have and share it when possible with the policymakers and also the public, but understanding that our roles, my role especially right now, is slightly limited because I'm used to working in an academic setting where I can share information freely, but now as a reservist, I have to walk that very distinct line between serving my community as an activated soldier versus an academic.
Well, we appreciate all the work you're doing, both in HAIMA and as an academic, and for joining us today and really giving us a reality check on this. There is no foolproof way to invite visitors back, but there are obvious steps that we can take to reduce our risk, and we thank you for laying that out for us. Thank you so much again, Dr. Thomas Lee, for joining us this morning.
Thank you for having me.
Aloha, thanks.
Yeah, and we invite you, and mahalo to Hawaii Data Collaborative for partnering with us for this By the Number segment. We're doing it every Monday after the governor talks to really give you some science, some data that you can then kind of understand, why do I need to wear a mask? Why do I need to stay 6 feet apart? It's reassuring to me, at least, to know that if I'm taking those measures, they actually do have an effect. And so check out their website. They've got a lot of really good information. And as Dr. Lee said, it is very digestible, even for someone like me who cannot understand science.
Yeah, and I mean, it's really interesting to hear some of those cases and some of those other things that, we're learning about what's happening. He gave a great example of the testing that was happened in the military and just the overall impact of how it can still spread. But to know that really the importance is on that contact tracing and really identifying those clusters. And also echoing sort of what the governor had also talked about earlier on, and how he says the state is much more prepared for that sort of efforts than they were, say, 2 months ago.
We've got a lot to talk about tomorrow. We're going to be diving deep into those travel corridors, as we said, and we've got a busy week ahead. Tomorrow's Paul Unamine to talk about that. On Wednesday, we're going to be talking to Dr. Palladino. He's from Straub Medical Center. He's actually been on the front lines treating patients with COVID. So we're really excited to hear from a doctor who has direct knowledge and experience treating patients with COVID here in Hawaii. What do the cases look like? What is the treatment like? What are the outcomes? We're really excited to talk to him.
That's right. And we will also catch up with the mayor as well later this week. So a lot of exciting guests. Again, we encourage you to please continue to ask your questions and let us know who you want to hear from. We'll try our best in the remaining time that we have on this program to get as many people as we can on here to get you more information. Of course, we like to highlight some of the good things that are happening in our community. And today we'd like to highlight a special organization in Hawaii. Our Hawaii hero of the day is the Mental Health America of Hawaii Association.
Yeah, so many folks are obviously challenged by the immense stress of this pandemic. Here in the islands, we're talking, of course, about the economic stresses and the physical stresses. And so we thank Mental Health America of Hawaii for providing mental health and wellness programs, along with resources for thousands of Hawaii residents in need of mental health support. They also do a lot for youth. They've been doing COVID-19 training webinars. They have a helpline, a healthy relationship series. We know that a lot of families are very stressed, and so how do we all live together? So they've got some great programs. A lot of those virtual seminars are live streamed, and you can check them out. So again, we thank Mental Health America of Hawaii for all they're doing to make sure that we stay very healthy mentally in this very, very stressful time.
That's right. Again, we encourage all of you to go back and watch. I know there's still a lot of questions coming in from what the governor had mentioned. We encourage you to go back if you missed the first part of it to hear a little bit more about the governor's discussion on the reopening efforts of the state, as well as hear some more of the other updates that he sort of announced earlier today in our show. Again, you can always get more information by visiting the Honolulu Star Advertiser's website in that specific COVID section. We also have all of our shows and interviews archived there as well. If you missed any of the previous shows that you want to go back and watch, we encourage you again to continue to comment and share this conversation. We also want to thank our sponsors, the Hawaii Executive Collaborative and Hawaii Pacific Health, for making this conversation possible.
We'll see you tomorrow. Until then, have a great day. Wear a mask, stay 6 feet apart, stay safe, stay healthy. Aloha.
Aloha.